So, Minister, what are the new measures that you put in place, or what are the new resources you're adding to try and deal with the backlogs at airports?
So today, a few days ago, I told you we added 400 employees to CATSA. Today I can say that that number now has gone up to 865 employees. Anyone who understands the complexity of hiring 850 people or 860 people in such a short time, you know that this was a major achievement, and I want to thank CATSA for doing so. So this is going to add tremendous amount of resources to help CATSA. CBSA has also added resources, including summer students that they've just hired. They're adding kiosks at airports. We've also, for example, some of the measures that we've adjusted, we now no longer require international travelers who are connecting to be eligible for random testing. So that is going to reduce potential bottlenecks. There are other measures that are being discussed with airports and airlines that we're working on that we'll be introducing hopefully in the coming days.
When exactly? By next week?
Look, I can't commit to you exactly, but there's a sense of urgency to do this, but we want to do it right. We want to understand the real bottlenecks, and we want to address them accurately and properly.
How long might it take before those extra 465 are able to actually get into the field and do the work? Because they're going to have to go through some training first.
Yeah, so it's 865, and we've actually done some streamlining to process new recruitment, including while they're being trained. There's now tasks that they can do called pre-certification tasks. So they can actually be on the field as quickly as possible within a couple of weeks to start helping manage the flow. The certification process takes a bit of a time, but even before getting certified, they are able to do some tasks on the line.
How many more people do you envision you need to hire to deal with the staffing shortage?
So just so you know, with those additions now, CATSA is at nearly 100% of the staffing level that it had pre-pandemic. So that's a major milestone. Yes, we will continue to assess the situation, and if we need to add more, we will do so. So, but it's good that we are back now to pre-pandemic level, even though travels have not gone back to 100% yet. But we want to be ahead of the curve, so we're adding more resources. And if we need to add more, we'll certainly do so.
I know you said it's a complicated issue and there's lots of moving parts, but in your estimation, what is the #1 issue that is making these delays happen?
So look, first of all, Pearson, out of all airports, has its own unique operational issues. That's why we're seeing many challenges there than any other airport. If you're an international traveler, you're feeling different bottlenecks than if you're an outgoing traveler. So incoming travelers at CBSA, lineups at CBSA, those are major issues. But other major issues is that flight schedule has not come back yet to pre-pandemic level. So we are squeezing now more travelers with less number or similar number of travelers with less number of flights. So also there are extreme peaks of arriving time and departure time that is causing this imbalance. So sometimes you land at Pearson and you have no lineups, and other times you have significant lineups. So we need to smoothen out the curve when it comes to ensuring that we have the right resources at the right time, and we're working with airlines on making sure scheduling issues are sorted out.
Does smoothing things out means canceling or changing flights for people that are already booked?
No, I will never recommend canceling flights, and I've been clear with the GTAA and others that we should do everything we can to smoothen a traveler's experience. I want to see more volume, not less volume, so I do not support canceling flights. Having said that, I leave the operational decisions to the airport in collaboration with airlines, but I want to see that they see that the government is there to support them. At the end of the day, the airport is in charge of its operation, but I want them to know that the government is there to support them.
In the matter of a couple of weeks, you're going to be seeing schools let out, families are going to start doing their travel plans. They've got flights going. How much longer can we expect these delays to happen, or the uncertainty even for passengers who want to go to the airport? Is there a timeline at all that you have for this to actually smooth out?
Yeah, so Cormac, from a few weeks ago when this issue started, I said that we're working on it, and it's going to take a few weeks because it's just going to require incremental work. We are certainly aware of the summer travel season. We want to have all the resources ready for the summer travel season, and that's what we're aiming towards. So we're working day and night. Staff is working day and night at airports, at airlines, at Transport Canada to get there.
Is this just a Pearson problem in your estimation, Minister, or do you see this problem happening with regularity?
No, look, I said to you the other day, if you look at Amsterdam's airport, there's a problem there. But it's important to look around the world and see also what's happening to help us be more informed about what's happening. So it's clear that we're seeing similar phenomena around the world. Pearson, out of all airports in Canada, certainly is the busiest one, and it has other operational issues that they're sorting out, including staffing shortages. So yes, sometimes you see it more pronounced at Pearson. We're not seeing similar, at least extreme waiting lines at other airports. Okay? Thank you. Today, I am pleased to say that that number has gone up now to 865. Anybody knows how complicated and lengthy a process of recruiting people is, to understand that 865 people within weeks to be recruited is a tremendous feat, and I want to thank CATSA for their sense of urgency in dealing with this. Those resources are going to be able to immediately, quickly help with managing volumes, travelers' volumes at airports to help alleviate some of the pressures that we're seeing today. That's on top of CBSA adding more resources, including hiring summer students, adding kiosks at airports. So we are continuously working with airlines, with airports, on other additional measures that we can do to help smoothen the pressure on our airports.
Is there also, since everything is interconnected, is it also on the airlines, is it also on the airport authorities to do their part to work together? Or I've seen tweets from Duncan D, former executive, slamming you folks for moves. I'm just trying to see how everything gets fixed. Oh,
undoubtedly, we're seeing tremendous pressure on every sector of our economy, including airlines, including airports, including suppliers of furniture, including suppliers of appliances. We are seeing tremendous pressure on supply chains, on labor shortages. So we are seeing this across the sectors of the economy. We are working, and by the way, still flight schedules has not returned to normal yet, so we're seeing more travelers in a less number of flights. So there are additional issues that need to be sorted out. That's why we have these working groups that are set up that include airports, airlines, and CATSA and CBSA and public health, sorting out these things on a regular basis.
Minister, what is the medical rationale for continuing to have a mask mandate and for continuing to have a vaccine mandate?
Okay, so these mandates are always assessed and reassessed. The evidence that masks reduce transmission is unequivocal and quite clear. It's 60 to 80% reductions of chances of transmission. So while we are always looking at the evidence and assessing it, the masks continue to offer tremendous protection for everyone.
But Ontario has just lifted its mask mandate even for hospitals. Like, if they're not needed in hospitals, if the risk assessment is they're not needed, how do you still explain why in Canada they're required on planes and trains?
This is not the first time that you see different jurisdictions make different decisions based on the same science that we're all seeing. So I can't comment on behalf of the Ontario government, but I can tell you that the evidence we see is that masks continue to reduce odds of transmission. So they are an important layer of protection. It's not 100% certain, but it's a layer of protection that offers protections to passengers.
And what about the vaccine mandate? Is it fair, given that everywhere else has lifted their domestic vaccine mandate in Canada, that your government's policies are banning families from visiting families across the country if they're not vaccinated because they can't get on a plane or a train?
Yeah, the same applies to vaccine mandate, just like I said about masks. These measures are always getting assessed and reassessed, and we are currently reassessing
But what is the justification for it? Because you're seeing all these delays in the airport. The airports say that this is part of the delay that's adding to the bottleneck, and the government seems to be the exception in saying these are still needed when every other jurisdiction in Canada says they're not. So what is the justification for it?
Well, I mean, other jurisdictions in Canada still have vaccine mandate. In BC, they have vaccine mandate, I think, for the health sector. And
but not
in
for
other,
the average person.
Those people who work in the health sector.
Right, but not for the average person in a restaurant or traveling.
Exactly. I don't want to argue specifics with you, but you said there are no mandates across the country. I'm saying there are mandates across the country. There are mandates across the world for travelers, for other. Having said that, we are assessing the evidence that we have right now. We're always erring on the side of public safety. We committed to Canadians that we want to do everything we can to protect their health and safety. And we're seeing people and governments and jurisdictions try to grapple with making the right decisions and the right balancing act with balancing public health and economic fluidity. That's what we're doing. We've lifted measures.
But what is the technical justification then for the vaccine mandate?
Well, again, that's being assessed. But the science about vaccination protecting lives and preventing death is clear. The science is unequivocal. Vaccines protect lives, they save lives. That is part and parcel of our considerations for public health measures. Now,
but you don't have a 3-shot mandate. You have a 2-shot mandate that does not actually prevent the spread of COVID with Omicron. So it's not.
You're like, as if you are with us in the room when we're having these discussions. A lot of these things are being considered. A lot of these aspects of our policies are always re-examined. I could tell you that these examinations and re-examinations are taking place on a daily basis, and when we feel it's the right time to make and adjust our measures, we will do so.
Minister, and what about the COVID Act?
Minister, there was a joint statement just out about saying, like, do you recognize that there is more to do? What do you say to Canadians that read that and say, well, nothing new is announced, no new measures, so...
Well, I mean, I would say that there's new measures announcing that 865 people have been hired just recently by CATSA. That's a tremendous achievement within weeks. I would say lifting the requirement for random testing for international connecting travelers, that's a new step. I would say adding more resources to CBSA is a new achievement that has happened just the last couple of weeks. Having said that, is there more to be done? Yes, and that's why we have these working groups where airports, airlines, and others are working together. We in government are assessing and reassessing. We're taking advice from our stakeholders, and as I said, there will be new measures that will be announced soon.
When?
Soon.
The bottlenecks, though, like the bottlenecks are big. It's an international scandal how bad Toronto's airport is, for example. So, like, it's incremental steps that you're announcing so far. You're not removing any of the bottlenecks that are slowing down travel. ArriveCan, you still have to fill out, and there's not even, you fill it out, but there's actually not much that you do with the app once you've filled it out. There's checking, there's delays to check it, but it doesn't go anywhere.
So, you know, Canadians who want governments to be responsible and address problems head on want the government to fully understand the root causes of the problem. And when we look at similar problems in Amsterdam, when we look at similar problems in Paris, when we look at similar problems in Vienna, when we look at similar problems in London, we know that this is an international phenomenon. We're seeing similar outcomes in Pearson. So we are learning from other, and by the way, those other jurisdictions that don't have similar public health measures, some have stricter, some have less. So, but having said that, I don't think it's fair to say that this is a unique problem that we're seeing at Pearson. We're seeing it across the world. Having said that, I'm not saying that to say that it's acceptable. It's unacceptable, and we are doing everything we can to address them.
Except that other airports don't have the problems. You've listed airports internationally that do have the same problem, but many other airports around the world don't have any of these problems. So how do you explain that part?
So you compare airports at the same scale. You compare, obviously, here in Canada, the airport with the most issues that we're seeing right now is Pearson for a lot of reasons, because it's the largest, because it has operational issue, it's a massive hub. We're not seeing to the same degree similar problems in other Canadian airports. So that tells you that there are volume operational issues that we're seeing similarly in other larger airports around the world. Thank you very much.
So when will
Thank you.
these bottlenecks be addressed? When will you make a final decision?
They are, as I said,
when will you make a decision on the mandate, on the vaccine mandate, on the mask mandate?
We're doing this by candidate.
On arrive
Candidate is a big
can.
flex point for travel. That's why I'm asking about.
So I appreciate the question, and I understand the sense of urgency, and I'm committed to doing everything we can as quickly as possible. So is our government. We are aware that there's a summer traffic season, summer vacation season. We want to get everything in place in preparation for the summer travel season.
So July
Thank
1
you.
it will be fixed?
Stay tuned. Stay tuned.
Thank you.